Um, I mean, the process overall is fairly similar to it being seen in person, with I guess a couple exceptions. Main one is when they're first connecting, instead of them again driving, traveling to wherever a clinic is, instead they're connecting for us from the comfort of their own home or their place of employment. And so they still, and instead of walking in a door, they click on a link, and they're met by a coordinator who does intake and asks them some questions similar to sitting in the doctor's waiting room filling out a questionnaire. Someone goes over those same steps with them and connects the patient and creates a little bit of information for the provider to be able to see later on. After that information is collected, they are then put into my waiting room, and I'm notified that there's a patient there. And then as soon as I'm finished with the prior patient, I connect with my next patient. The actual doctor-patient experience, the first part's pretty is basically exactly the same. I still talk to you, and we still talk. We discuss what the injury is. I ask questions and follow-up questions to try to understand what is going on with them. The biggest difference, though, is the exam. Obviously, I can't reach through a screen and have them move around. So instead, I have to teach the patient how to examine themselves, essentially. But you can get a lot of information that way. And so they'll go through the exam the way it's modified for a telemedicine exam. I'm still able to come to a diagnosis, talk to the patient about what I think is going on with them as far as their diagnosis is, outline a treatment plan, a suggestion, and a plan for follow-up. And then based on that, again, just as if you're being seen in person, I answer any questions that you have. And then upon completion of the visit, we provide the patient with discharge paperwork or end of visit paperwork that explains the treatment recommendations that we discussed. We give that to them in written form, any follow-up information, any referrals that they have to a physical therapist, or recommendations that they get an X-ray. All that stuff is provided to them again, just as we would provide that stuff in person. And Then we'll have them check out with the coordinator one last time, just to make sure any final questions are handled before they go on their way. And then we tend to see all of our patients back on a relatively short-term basis, especially after the first visit, to make sure that nothing's slipping through the cracks and that patients that they're progressing the way that we would want them to.